Welcome back, everyone. Now, more than 90% of Australian adults experience tooth decay, and what's terrifying is that most oral health issues are caused by everyday habits that we don't know are doing us harm.
Now, here to combat Australia's growing toothache is dentist Mark Nieh. Thank you for joining us, Dr. Mark. Thank you, sir.
Thank you for having us.
Dr. Mark.
How are Aussies simply damaging their teeth day to day without even knowing it?
The first thing is people have a misconception, over-brushing and brushing horizontally. Now, this causes not only damage to the enamel, but also to the gums. And unfortunately, damage to the gum is irreversible. Right. That's the first thing. Second thing, a lot of people don't realize you need to change your toothbrushes regularly.
How often?
Ooh, it depends on you, and of course it depends on where the toothbrush is kept.
Yep.
It could be in a humid environment, bacteria and molds will grow on the toothbrush. If you actually check the bristles, you can actually see it's gone a little bit dark. And then there are times where you look at the brushes, it's nice and clean, you've kept it in a dry place, you can use it for a bit longer. So
But would you say at least every 3 months?
Every
or?
3 months, every 6 months. And also the other thing, a lot of couples go on holidays and guys unfortunately forget to pack their toothbrushes. So they'll use their wife's toothbrush.
They'll share.
No.
This is not good, right?
Unfortunately, what people are forgetting is dental decay is a transmissible disease. Same as when grandmas used to feed their grandchildren with a spoon, they're passing on decayed disease bacteria that's passing it on.
Apologies if you're having your morning tea right now, but with the toothbrush thing, you can tell when it needs replacing, can't you? It sort of goes a bit soft and icky.
It goes soft and it splays out. So it's almost as if you're not going to brush your teeth, it's going to rub it around.
So how do we achieve pearly white teeth without long-term damage, Dr. Mark?
So one of the few things that I will recommend, obviously, is to clean your teeth twice a day. Now, that's a very basic concept. Clean it properly for a good 2 minutes, floss once a day, and brushing your tongue. Now, brushing your tongue is a very important thing a lot of people are forgetting, is because the bacteria that causes dental decay also sits around in your mouth and your tongue, and that can also go to the back of your throat and give you bad breath. So I think these are the very important topics
It makes me gag when I do my tongue. Is that just me? What is it?
No. A gag reflex is...
That surprises me, actually. I don't know why, but it sort of does.
I'm speaking to the doctor here, if you don't mind.
Well, I'm sure you're eating okay. So if you can eat okay, I'm sure you can brush your tongue okay.
See? There you
but
go.
be very careful. Obviously, there are people with strong gag reflex.
I've got them.
Yeah. So with those ones, just go a bit slower.
Can I also ask you about flossing? Because you say once a day flossing with the sticks, right? I find the sticks
A lot of people find the sticks are easier, more convenient, more subtle than getting the floss out.
Because you need to do them, because otherwise you get gum disease, right?
Absolutely. So flossing is just one of the many ways you can clean between the teeth. Now, the principle of it is to clean between the crevices, and one of the biggest challenges we have with the obvious standard toothbrush is not going to reach that. So the picks, what we call the Pixter, which is made by Erskine Dental, a very popular Australian brand, great product.
Are they the ones that look like little toilet brushes?
Exactly.
Yep.
Same principle, but slightly different, of course.
Okay, yeah.
You don't...
Because you need to get into the gum, don't you?
Absolutely.
That's why flossing is preferable.
And down the brush.
Yeah. What about fluoride in toothpaste? Important?
Ooh, fluoride in toothpaste is a very controversial topic. As many of you would know, there are health risks and benefits. Now, the biggest thing in dentistry with fluoride toothpaste, we like it because it provides immediate topical protection. Okay? When you brush it, you're supposed to just brush it with it, gently rinse it out, and that's it. You're not supposed to be ingesting the toothpaste. We're not asking you to poison your system.
Gotcha.
OK, finally, it's been widely debated how often we should go to the dentist. What do you think?
All right. So the standard routine we tell most of our patients is 6 monthly, every 6 monthly, ideally have a visit. It's a bit like getting your car serviced. If you would be happily taking your car for a service, you use your mouth, unfortunately, a lot more than your car. So it makes sense to get it checked at least 6 monthly.
Not once a year.
If you do once a year, twice a year is ideal. Of course, that's open to debate.
Yeah, good on you.
Look, at least you don't have Dickie as a patient, Dr. Mark, because every time you go in there, he'd be like,
I found that very interesting. No, I did.
Thank
you, Doc. I'm glad we could show your face, too.
Coming up on Today Extra, put a